Hello, everyone, and welcome back to another one of Co-Produce Care's live streams. I'm absolutely delighted to have a fantastic guest today. I actually think it's our first MP this year. So we have Greg Stafford MP, and he's Conservative MP for Farnham and Borden, and also a member of the Health and Social Care Select Committee, which we've talked about before. And I would really appreciate, I know a lot of you do watch back after the live stream, but if you are watching live, I really appreciate if you would share this live stream with friends, with colleagues, and interact with us. So pop in some questions into the chat, anything that comes to mind, any thoughts. It could be even where you're watching us from. Maybe you're watching us from different part of the country or the world even. Just get some interaction with us. It's quite nice to be quite friendly on these platforms. So I'm not going to hesitate too much. I'm going to bring Greg straight in. And just a reminder, subscribe if you're on our YouTube and like us. It just helps more people find out about our content. Yeah, hopefully you'll enjoy our live stream today. So, hello, welcome, Greg. How are you today?
I'm very well, thank you. Thanks for having me on, Sophie. I'm very delighted to be here.
It's wonderful to have you here. And as many people know our network, we do reach out to a lot of MPs and a lot of politicians, because we're not just about talking about social care amongst ourselves. We want to talk to everybody, decision makers, policy makers, as well as people who work in the sector. Thank you for accepting our invite to come onto the live stream. Really appreciate it.
Pleasure.
So I think I'll just jump in and ask a little bit about yourself, so anyone who's watching can find out, who you are, how you got into politics even, and then what your interest in social care is in particular.
Yes, so as you kindly introduced me, I'm the Member of Parliament for Farnham and Borden, but that also encompasses other areas such as Liphook and Haslemere, essentially on the Surrey-Hampshire border. I'm one of the rare MPs that crosses a county border, which means I see social care across two counties, which is interesting to compare and contrast the differences. My background before I became a Member of Parliament was in the healthcare space, everything from working in the pharmaceutical industry through to the regulatory sector, charitable sector. And in the last 7 or so years before I became a Member of Parliament, I actually worked in the NHS for a programme called the Getting It Right First Time programme, which essentially was a clinical improvement programme trying to ensure that we saw improvements in clinical care and therefore the knock-on benefits to patients in terms of reductions in length of stay, reductions in infection rates, just general better practice. And that's why I have such an interest in this issue, as well as being employed, I would say, in the sort of health sphere. I was also 17 years a local councillor in West London. So from that point of view, I had a lot of interaction with social care teams and the social care issues that are going on. I chaired, when I was there, the health and social care scrutiny panels. And now that I'm in Parliament, I'm on the Health and Social Care Committee. And one of the key reasons that I wanted to get onto that committee was because I felt that in health as well, but especially in social care, we're not, as a country and as politicians of all different stripes and parties, not really grasping the nettle on this and actually making the fundamental changes that I think are needed to actually make sure that we can provide decent social care for people who need it. And it wasn't the only motivation factor to become a Member of Parliament, but I think it was certainly one of the driving factors. So I'm really grateful that my local constituents have elected me, because I think hopefully it gives me now a platform to advocate on health and social care issues across the country.
That's really good to hear how much you've actually worked around health and social care. And I mean, they're two massive areas in and of themselves. So I'm interested, you talked about the regulatory space. Was that with the CQC or a different regulator?
No, it was the professional regulator. The professional regulator for dentists and dental care professionals. And I did, I was there for about 4 years, probably about 2013, probably 2012 to 2017. But some of the, to be frank, failings, I would say, that some of the professional regulators have, I'm afraid, also followed through to the CQC. And whilst there are some excellent things that the CQC does, as I'm sure your viewers are aware, it's not an organisation that's currently in a happy place, and it needs, again, quite significant reform going forward. And I think the new chair, who we had in front of us at the Health and Social Care Select Committee a few weeks ago, I think was very alive to the issues there.
I do want to come on to the Health and Social Care Select Committee in a moment. I'm quite interested to understand, is there anything coming into the space of social care? You mentioned about a lot of politicians or policymakers might not really understand what things are going on. Is there anything or theme that has come through to you in getting involved in the sector and understanding the sector a bit more recently that has surprised you or worried you in particular?
Yes, I think there's a general perception from the public that all health and social care is part of the National Health Service and that it will all be free at the point of use. And I think only those who have to interact with social care, I have to say, really have a better understanding of that. And I think it's also a challenge for us as politicians to work out what we're going to do in order to be frank, fund social care, because I genuinely believe that we can talk about tinkering or changing all of that kind of stuff, but it will come down to the money. How are we going to fund this? Because we've got an aging population, and I know not all social care is to do with elderly people, but we have an aging population with a diminishing birth rate, i.e. the people who are going to pay for health and social care. And so therefore we have to have a frank conversation about how we're going to do that. And it might be that we just put it onto general taxation. That requires a conversation. It might be that it's a fully insured model that everyone has to pay, and that's another difficult conversation. Or it's some kind of combination of both. But what we really can't do is spend our time, or spending a vast amount of time, deliberating over that. Because as we do, the problems only get worse. And that's why I think, to be frank, it's make or break for social care currently, and I would certainly say within this parliament, because if we as politicians don't make that fundamental decision about where the money is going to come from, then I think we really are in trouble, and we will see that as we go.
Do you mentioned a few ways that social care might be funded. Do you have in your mind any preference from people that you've interviewed in the select committee where you've thought, actually, I think maybe one form of funding might be better than another? Or is it something that probably needs a bit more of an inquiry or information gathering and maybe even cross-party approach to?
Well, it absolutely needs a cross-party approach, because the reality is whenever a political party, whether it be Conservative or Labour, have put something forward, essentially the other party has shot it down for, to be frank, political reasons. And it's absolutely ridiculous that Andrew Dilnot's review and bill actually received royal assent twice, but is still not the law, because political parties have kicked this into the long grass over and over again. And we've seen it again this time, and we're having another review into social care funding, which, to be frank, as much as I respect those running it, I don't know what more it's going to tell us that we don't already know. And the talk is that it's going to take for another 3 years to do. Again, I don't know what we're going to find out over this next 3 years that we pretty much don't already know. So my preference, if that's the right word, is to introduce as close as possible the Dilnot review. It was, as I said, a hybrid model where over a certain threshold you would have to start paying, because I think that's the reality. But what we can't do, and I think another of my fears about this political buy-in and all of that, is that if it takes 3 years to come to that same opinion, that'll be 6 months probably before a general election. And at that point, neither the politicians nor the public will have had time to really sort of talk about it. And there will be difficult choices, and there'll be things that people will not be happy with, especially if they don't have the time to really understand and digest the facts. And we'll see at the next general election, political parties bouncing off each other and undermining this. So I would rather see the review that's going on at the moment take 6 months to a year. Let's get it sorted and then spend the next 2 or 3 years explaining to the public, cross-party, why this is the right thing to do. And then we can then move on to the really important bit, once we've worked out how to fund it, is how we're actually going to properly deliver it.
Okay, that was really interesting to hear. And I'm sure lots of people who might be listening live might have a question or a thought or a reflection on how social care should be funded, or anything that Greg has just mentioned there. But while people are thinking, I'm just going to circle back to the Health and Social Care Select Committee, actually, because I think that, they have done a lot of inquiries. And as co-produce care, one of the things that we've done in the past is we've gone out to our members and we've done joint consultation responses to inquiries in the past. But I generally think that there's a little bit of a lot of people aren't aware of the work that the committee does and the impact people can have in engaging in any of these inquiries. So I would really appreciate you to just talk about the Select Committee a little bit, just to introduce it to people, and talk about what your role is on the committee.
So Parliament has a number of what we call select committees, and it selects because it focuses on specific areas, usually covering a department. So in our case, the Department of Health and Social Care. It's not always departmental based. And it's a group of cross-party members of Parliament, though the numbers on it are proportional to the overall political party proportions. So there is a predominance of Labour members of Parliament and fewer Conservative and Liberal Democrat members of Parliament. And our role is to really take a deep dive into some of what we feel are the key areas that need looking at over a Parliament. And so that we've done reviews in the past on things like dentistry, many times on social care, food and health. We've looked at the department itself, and really our role is to scrutinise and come up with recommendations, having listened to witnesses and experts. And when I say experts, I don't just mean people in white coats or that, though they are very valuable, but also people who use services, patients, people who are carers, and get that information. And to be frank, that's what really brings the stories alive. So if your viewers are interested in social care, or indeed any of the other inquiries, they can go onto our website, just type in Health and Social Care Committee. I'm sure it'll first come up on your search engine. And there will be opportunities to feed in, definitely in writing, but also opportunities potentially, if you wish, to come before the committee if you've got a powerful enough story or a clear enough piece of evidence that you want to give. And I want to reassure you, it's not like sitting in a court or anything like that. It's not evidence, like, you're not going to be cross-examined. It's really an opportunity to give your view. And we've done it in a very kind of old-fashioned way, sometimes where we have a witness and we ask them questions. But we've also had round tables. We've allowed people to come in online if they're not comfortable to come in face to face. We if necessary, we've let people come under pseudonyms so that the public don't know if they've got a particularly story that they don't want to be associated particularly to themselves. So we are very open to trying to get as much information from as many people as possible to help us form our recommendations to government. And that's the key thing, because we are a committee of the Houses of Parliament. We have certain legal requirements, which are that when we produce a report, the government is forced to respond. So it has to essentially say, yes, we agree with your recommendations and we are going to do X, Y, and Z to implement them, or no, we're not going to implement your recommendations and these are our reasons why. And I think that's very important. It's unlike if I was an individual member of Parliament and I wrote to the Secretary of State and said, please, can you do X, Y, and Z? He could acknowledge my response, but he doesn't actually really have to say anything. The weight that the Health and Social Care Scrutiny Panel Committee has is far greater than the sum of its parts, as it were. And we try, as we say, with cross-party, we try not to be too party political. If we have the Secretary of State in front of us, I have to say I suspect that the opposition members of Parliament are a little bit more vociferous than the government ones, but that's to be expected. But most of the time, it's very consensual, very consensus-based, and we've just, we may come on to this, have released a report in the last day or so on the cost of inaction in social care. And I think that's quite a powerful report. And I do hope that the government will take it seriously, because it says it much more eloquently than I've tried to explain to you earlier why we really need to get on with sorting out social care.
Excellent. And what I will do in a moment is try and put in the chat, or maybe someone in the studio can do it for me, the Health and Social Care Select Committee website, because I think that report, I'm quite looking forward to reading that over the weekend as well, and just generally understanding what you do. I was actually going to ask this question, and Stephen has put it in the chat, around the effectiveness of the committee, because I remember when I first learned about the committee a few years ago, I was really excited, because I thought finally you can have people with lived experience, you can have people who draw on social care, you can have alongside academics and other people in front of a group of MPs and talking about their experiences and really hoping to get change because of those tangible emotive experiences are being shared with decision makers. And then over the years interacting with the committee, I've seen that the work that goes in when people respond to inquiries, and I do encourage people to go and you can look at individual submissions as well, written ones, as well as going back and looking at the Parliament TV meetings that happen. It's a wealth of information. But then the frustration is, of course, the government, as you rightly say, has to respond. But then where does that go? So, Stephen put up, I worry that the Health and Select Committee doesn't really have any teeth. Jeremy Hunt issued a report when he previously chaired the committee that highlighted many issues around workforce. But the question goes on to say, what's different now? I wonder, do you have the same frustration, or there's not really much that you can do apart from wait for the response from the government?
Yes, I mean, I'm a brand new member of Parliament, so I try to come to these things with as generous, I suppose, point of view as possible in terms of hoping to affect change. I hope I don't become cynical over the next four and a bit years or whatever it is. But Stephen's right. We don't have the power to change anything. We are not the government, and only the government has the levers of power to fundamentally change something. I think what we can do is highlight and recommend and do first of all, we can do the sort of deep dive scrutiny and evidence taking that, to be frank, the department probably hasn't got the time or the interest to do. We also look at the things that we think are the priorities as a committee, which may not be the priorities that the government has of the day. But what we can do is highlight the issue. We can make recommendations. And if we feel the government is not making the changes that we have recommended, or that their response back to us is substandard, then again, we can make noise and fuss about that. And it is a brave, I would say, Secretary of State who would entirely ignore the recommendations of a select committee. Now, it doesn't mean that things are going to happen quickly, and they clearly haven't, and I outlined that in answer to the previous question. But I think the coverage that we've had of our report in pretty mainstream papers, this isn't our report on the inaction in social care wasn't just confined to kind of the sort of sectoral press. It hit every of the main newspapers and outlets. And I think that gives it an awareness both to the public who may not be involved in this conversation about social care, but more importantly, raises it up the Secretary of State and the department's view. So I think I don't want to pretend that we have any kind of great powers, but what we do have is influence and the ability to be frank, cause the government a bit of discomfort if they're not doing the things that we've recommended.
Okay, that was really helpful, a really helpful reflection. And I think maybe, you're right, actually just raising awareness of the committee and the work it does, and everybody can have a part in doing that, actually, not just people like yourself who sit on the committee. I hope you don't mind me going to the chat. It's finally woken up. People are starting to ask questions, and I think that they're interesting and quite thought-provoking ones. So I appreciate it. Please continue to do that. So I've got one here from Jacqueline who talks about raising, and thanks you for raising awareness, which is great. But the rates of pay paid by local authorities are not viable. So this would be in relation to delivery of social care. And so providers, our local authority subsidise local authority clients with private clients. So, what happens for anyone who might not be aware is if you have somebody you are a care home provider, and it costs a certain amount of money for a bed to run a care home, and for a bed, sometimes the local authorities aren't able to pay that rate, but providers still want to provide the service. So private providers who pay themselves, their rates of pay, the cost what they pay to be in the care home might be higher than what the local authority can pay, and that effectively subsidises people who go into care homes who are funded by local authority. So I feel like I fudged that a little bit, but hopefully that makes sense to people. I'm guessing you understand what's meant by the question as well, Greg. So yeah, your reflections on
yes, I think Jacqueline's absolutely right. Either what happens is the money comes from, so either the local authority does provide it and it pulls money that's not ring fenced for social care from other services, and we're seeing that more and more because, to be frank, local authorities have essentially become a social care provider, which again, for people who are not involved in this sector, is a massive surprise. They think their local authority is there to do bins and road resurfacing and that kind of stuff, which of course it is, but actually that's an absolute fraction of the amount of, in terms of monetary terms, in terms of what they spend their money on. So you either have that, or as Jacqueline points out, that essentially the private payers are subsidizing the local authority clients. And again, that is inequitous on the other side. So going back to the money, how we pay for this is absolutely essential. And I think there is a strong case to be made that actually delivery of social care through local authorities is perhaps now an antiquated model, and that there needs to be a more centralized version of this, which is an interesting thing to me as a Conservative who is very much a localist and want things to be provided locally. But I do think that local authorities are not set up to provide the amount and the level and the diversity of social care that we now need for our population. And I think there's a democratic deficit there as well, because, as I said in my introduction, I was a councillor for 17 years, and I can probably count on the fingers of one hand the number of times I knocked on the door as a local councillor, in run-ups to elections or whenever, and had a conversation about social care with someone on the doorstep, initiated by them, because they were electing their local councillor based on whether the streets were swept or whether the roads were repaved or whether the streetlights worked. They were not electing me or any of my colleagues based on social care. And I think there's a massive democratic deficit there, because we're electing people to be in charge of something. We're electing people to be in charge of something so vital, but actually the electorate don't really have any understanding of what that councillor's role is in that. And so I think there is a real problem there, because we potentially don't get the right people to solve that problem, because they know we don't need to solve that problem, because in 4 years' time, I'm not going to be elected on how good the social care is. I'm going to be elected on whether the streetlights work. And I think that's a real problem.
That's a really, really interesting point, actually. I hadn't thought about it in those terms. It's the motivation to sort social care as well. So Jacqueline has pointed out that her question was in two parts. I'm just going to flash it up and move on, actually, just to do you justice, Jacqueline. So she also points out that the funding issue also has an impact on people staying in hospital longer.
Yeah, absolutely. I mean, on that point, it's social care is much wider than just people not being able to get back into their locality because they're stuck in hospitals. But it is a part of it. And one of my roles prior to being a member of Parliament, I worked for the Royal College of Occupational Therapists, so I know exactly how hard they work and their frustrations about wanting to get people back into the community, but not having either the staffing or the equipment or to be frank, the availability of just a physical place to put people, it being a really, really big issue. And of course, we haven't really talked about workforce yet, but workforce across the professions that work in social care is a real challenge as well.
Absolutely. I've lost this comments coming quite a bit now. Thank you, everyone. But Katrina, I can't find her comment now. Oh, yes, here it is. So thanking you again for joining. We get very excited when we have an MP come on. So thanks everyone for appreciating that. Can I ask, what is this, Katrina? Can I ask why is profit in social care such a dirty word, which it is seen as by many? When providers innovate and reduce red tape, this should be rewarded. We are looking to digitalize, which is amazing, but tech companies will make huge profits and this will be deemed okay. I think this is a really interesting conversation because there is actually quite a lot of engagement of trying to get care more digital and AI, and there's a lot of investment. And I actually do hear governments talk about that. I don't know whether it's a bit more of an easy win than the harder questions, but her real question is about that, the positivity around that, rather than appreciating that care providers in what they do are quite innovative, and some are non-profit and some are for profit, and we shouldn't really be making a distinction between good guys and bad guys. So I suppose your reflections on that.
Yeah, I think that's absolutely right. Certainly, profit to me is not a dirty word. And the private sector, both in healthcare and in social care, but especially in social care, provide an absolutely life-saving service. If the independent profit-making companies were not in the sector, social care would fall over. I'm not against that at all. In fact, I think what we need to do is to think about, well, what do the providers provide? How well are they providing it? Does it fill the gap in the market that we see? And if it is, then that should be encouraged. So I think there are. I'm not wedded to any particular model, whether that be state provided, not-for-profit, profit, mutual, charitable. All of these things have a place within the social care, sort of the social care market, for want of a better word. And some great innovation comes out of the private sector for this. So no, I don't think it should be a dirty word, and it goes back to my point at the start, which is about how we're going to fund this. And that's got to be part of it as well, I think.
That's really helpful. There is a question from John Hislop on LinkedIn. I appreciate it. It's a very long one. I'm not going to put it up just yet, but if we have time in the end, I might come back to it because I do want to get onto workforce. And you did mention workforce. It wasn't particularly one of our planned questions for today, but I wouldn't mind hearing your reflections on workforce. I know that the Health and Social Care Select Committee has reported on workforce before. So yes, your reflections on social care workforce would be really helpful to understand.
Yes, I think that first of all, no one really. It's not as easy to define workforce in the same, perhaps as well as easy as it is to define workforce in, let's say, the healthcare sector. You can. Okay, there are a lot of professions, but it is entirely professionalized. So actually, what the social care. It covers everything from a professional, as we've talked about, like an occupational therapist or a nurse or a physiotherapist, and everything down through. I don't mean down in a derogatory way, but all the way through to people who are caring for relatives and loved ones at the other end. And that is really much the whole workforce, because even people who are not employed to do that are part of that workforce. Now, what I think is key is that, first of all, we need to give much more respect to this and put it on a par with the healthcare workforce. I think it's secondly, we need to ensure where necessary that the sector is more professionalized, but that is not always necessary. We need to pay better, and we need to be frank, make it a profession that people who are already in this country are keen and see it as a proper profession. And I'm afraid at the moment, I don't think many people, unfortunately, see social care work as, especially sort of the more simple elements of that, what I call the caring sector, where it's not professionalized, it's just doing care, to see that as a proper career, and therefore have those career progressions that anyone in a job would want to see. And that, I think that would make a huge difference, because, we need to make sure that we, use our homegrown staff and as much as possible. I think that would make a real difference. But like all of these issues, it is a really, really thorny one, and there's no magic wand to wave to say suddenly we're going to pay people who are working in social care vast amounts more money. There's no magic wand that's going to say we're going to now recruit hundreds of thousands of more care workers overnight. This is why we really need to get a grip on this very quickly. I think I saw someone in the comments say we can't take years, it needs to be in months. And I think it's probably somewhere in between those. But I do think that by the end of this year, the Casey report, Baroness Casey, who's now doing this next report on social care, who, as I said before, I have an immense amount of respect for, and she will do an excellent job. But we need to get that interim report out by the end of this year, and then the politicians need to make the decision, cross-party, and we get on with it, because we cannot wait for years and years and years for this, and put up with the inevitable general election, which will change the composition of the parties, and we start back from square one again. And all the while, people are not getting the care that they need.
Okay, people who are watching live, your reflections on any of that would be really helpful. Jacqueline again points out that, you've talked about career progression, you talked about workforce and professionalizing the workforce, and part of that might be around training. I think what a lot of providers struggle with is we already give people a lot of training, but professionalizing is slightly different, is the extra cost and how that might be funded. Jacqueline points out the NHS is funded, and for training and for social care, it's not. Do you think that might be part of the reform that needs to happen to support the workforce?
Yes, and I think if Jacqueline's saying that there probably needs to be let's call it state funding, taxpayer funding for training, I think that would be part of it. Certainly, it's interesting that the comparison with the NHS, because there is an argument, and it's not necessarily one I agree with, but there is an argument that we actually pull all social care into the NHS. Now, I probably am not in favour of that, but if it did, then that would be a mechanism potentially for doing that training. But yeah, I think Jacqueline's absolutely right that there needs to be avenues for proper training and within the sort of the state funded sector.
That's a really good reflection. Thank you for that. We've actually gone through quite a few things. Actually, we've talked about the inquiry, we've talked about the select committee, and we've talked about your interest in social care, and a little bit about how it should be reformed. Is there anything else that you think is important in terms of the new direction for social care? I know that Labour's talking about a national care service, which potentially would sort out a lot of the problems.
But what does that mean? I mean, I've tried not to be party political on this, and I'm going to be trying to keep that. But I think all politicians of all colours over the years have slightly fudged this issue. So just by calling it a national care service doesn't actually solve any of the problems, unless what they mean is they're essentially going to make the National Health Service be replicated in the social care service area, the care service. And I just don't see that happening, not least because the cost would be astronomical. So I think we need to go beyond warm words. We need to actually make the change. And I think again, somebody in the chat that I can see has said something along the lines of that the solutions are out there. The providers know what the solutions are. The users know what the solutions are. To be frank, we as politicians know what quite a lot of the solutions are. It's now about getting on with the job and actually doing it.
I'm really interested, and you may or may not want to reflect on this, because obviously, and I feel like I have to ask the question because people are thinking about it. Obviously, the Conservatives were in government for quite a long time. What do you think really withheld the ability to get to grips with social care in the terms that you're quite clear terms that you're talking about now during that period? As a politician, maybe it's just everyone's politicking, and that's really distracting from pure action. But there was a lot of action during the pandemic in terms of, eventually sorting out funding people and people's lockdown. And there was a lot that governments can do when they need to do it. And I just wonder, on reflection, what lessons learned, or what do you think held the Conservative government back from making those changes whilst it was in government?
Yes, I mean, I think part of it is the politicking. As I mentioned, the Andrew Dilnot report came out twice and wasn't implemented. We had Theresa May's views on things, and the opposition at the time called it a death tax. We did the same when Gordon Brown brought various measures through. So it's just entirely unhelpful. I'm concerned the fact that we were offered cross-party talks on this. The first of those cross-party talks was cancelled by the government, and now seemingly they're not going to happen. And I think if we are not all on the same page on this as early in a parliament as possible, then there's going to be some problems, because I think it goes back to the funding. If we haven't sorted out the funding, we're not going to sort out any of this. What I fear is that, because you mentioned the pandemic, we had a crisis, and therefore we all pulled together and sorted it out to a greater or lesser extent, that crisis. What I don't want to happen is for us to have a crisis in social care. And I'm sure the comments are about to fly up and say we're already there. But a real crisis, a major crisis in social care, where, to be frank, people die. And then we go, now we need to sort it out. We must get there before that point. But I think we are very close to that point. I think we are only a parliament away from some real problems. And therefore, as I say, we it's difficult for me, because not being a member of parliament for 14 years you're talking about, to make any real assessment of the ins and outs of that. But what I am saying now is, we have this opportunity. If anyone, Labour, I think, has the freedom, both in terms of the public trust on the NHS and social care, and, to be frank, the pure raw numbers in Parliament, to make the difficult decisions now and get this done. And potentially, for 14 years, we didn't have the political room to make those difficult decisions. I think Labour absolutely does now, and so we should.
Great. And will you be pushing for that in your role as MP, in your role on the Select Committee? Again, back to Jacqueline. Sorry, good points to your racing there. Can you ask those questions in Prime Minister's question time? Is that something that you have the power to push for on our behalf?
Well, certainly, I'm pushing for it very hard on the Health and Social Care Committee, and any time I get a chance to ask questions, either directly to the Secretary of State West Streeting or any of his ministers or anything like that, I do. But, on Prime Minister's questions, I don't know if people, would it be helpful just briefly, I know we're wrapping up, just tell you how Prime Minister's questions work?
Yeah.
So every week we have Prime Minister's questions. You put your name into a ballot, and you're pulled literally pulled out of a hat as to whether or not you get to speak. But and that's totally random. But there are opportunities potentially to what we call bob for a question. So if you watch Prime Minister's questions this time, you will see members of Parliament standing up and sitting down. That's not just to keep the blood flow going. It is because that is the way we try and catch the speaker's eye. And even though there is a balloted list of people who are on that, the speaker has to choose someone from the government side, followed by someone from the opposition side, and keeps going like that. So if the ballot comes out with more government side people on it, he will be able to take a few opposition members who are not on the preordained ballot, and vice versa. If there are more opposition members on who've been pulled out of the hat, then there'll be more opportunities for people on the Labour benches to bob for a question. But again, those opportunities are few and far between. And if you've asked a question before, you're unlikely to be chosen again for at least 6 months, if not a year. So I did have a question about pensions, actually. I think it was just before Christmas. So I think I'm probably in the fallow period at the moment of a chance of that. So unless I get pulled out of the hat, I won't. But what I do say is that health and social care is my big passion. And therefore, I think it would be very likely, were I to get a question in Prime Minister's questions, that I would be able to put something on health and social care to them. Whether he answers it or not, that's another question.
Well, that is another question, indeed. Okay, well that was really, really helpful. I mean, I know we haven't put it into the plan, but we did have a question about health inequalities in health and social care, and I know you were thinking, there's actually work going on, so you can't reveal too much. That's absolutely fine, but just in a general sense, there are quite a lot of health inequalities in health particular, and in health and social care. Yeah. Did you have a view on some of the things that could and should be done to address those?
Yeah, so we had Professor Marmot actually in front of us, or yesterday I think it was, or no, Tuesday, in the Health and Social Care Committee, specifically looking at the inequalities in healthcare in children. But the points are the same. In every element of health and social care, those in in more deprived areas receive worse services and therefore have worse outcomes. I mean that's I'm afraid just blindingly obvious, and that situation has not improved to any degree, over a significant period of time. And so I think it's about making sure that we have much more targeted interventions, that we ensure that those communities, whether they be geographical, age, any of them, sex, gender, race, any of the things, deprivation, etc., are really targeted. And I think if we can get that right in social care, I think it will be a model for healthcare as well, because I think social care is actually in some ways much closer to the patient, for want of a better phrase, than sometimes healthcare is. And so I think if we can get that right, if we can get that sort of localized, personalized care in social care, then I think actually it will be a model for healthcare as well.
Okay, thank you. That was very.
Sorry, just on that, we are as a committee looking at these issues quite closely, and obviously I can't talk about stuff that we are or aren't doing with it until it's published. It's one of the other things I have to keep stum about, stuff that we haven't agreed on as a committee yet. But your viewers will see stuff coming out on this soon.
That's great. So I think that's an overall call to action for everyone to engage with the Health and Social Care Select Committee and the work that they're doing, and engage in any inquiries that come in the future as well. Have you got is there anything that you can reveal yet in terms of inquiries that might be coming forward, or people just need to sort of sign up to the newsletter?
Yes, I would ask people to sign up to the newsletter, and I think the one where we've just one of the ones we've just started is around what we call the first 1,000 days. So that's from conception to the age of 2, and we're really looking at essentially young children's and maternal health and social care. And I think that will be potentially, if your viewers have an interest in children's social care and maternal social care, I think that's something that we would obviously welcome right now, because we've started that report now. But there will be a number of other things as well that will be coming up. So please just look them up and input them, because social care touches all sectors, all people. So I would be very surprised if there is a report or an inquiry that we're doing that doesn't need input from the social care sector. I can't think of what that would be. So please do give your views. Please do submit evidence, because we do take it very seriously. We read everything. And even if it's not listed, if that's the right word, in the final report, everything is read and everything's considered.
That's brilliant. I'd be very interested in the first 1,000 days, and I do appreciate the fact that you're thinking of, when people are pregnant, basically starting the journey, the inquiry from that point. And I think actually health inequalities will come into that in a big way, because we know that there's a lot of disparity in terms of maternal well-being for ethnic minorities. So I think people should really engage with that inquiry. And just a last thought on that: how do you know what to do an inquiry on? How do you get the subjects? Do people suggest it, or do committee members?
Yes, people suggest it, and that comes from the sectors. It comes from members of Parliament's own inboxes and general interests. To be frank, some of it's a little reactive. So, for example, we are doing an inquiry onto the NHS 10-year plan. Obviously, we're doing that because the government's decided to do that. So some of it's reacting, but it's really about thinking about what are the key issues that are coming in for us as members of Parliament, elected members of Parliament, representatives of our constituencies. What are the key things that we're seeing in? And we have the professional side, the clerks of the committee, who advise and help us as well on that, in order, once we've said we want to discuss, for example, the first 1,000 days, who are the key people within the sector that we should be talking to, who are the professionals. But the sort of lived experience element is often the hardest one to find. So if you do have either yourself or somebody that you are caring for who has lived experience in any of the inquiries we do, please do put it forward, because it is, as I said, I think earlier, it's absolutely invaluable to not just have the statistics and the data and the professional view of stuff, but the patient or the service user or client, whatever words you want to use, is absolutely vital, because it does frame everything.
And actually, it's a really wonderful point to end on lived experience, because that's why we're all here. That's why we're doing this chat. It's because people are drawing from health and social care, and that is their lived experience, and how can we make it better? So thank you very much for joining us today, Greg, and appreciate having you here, and do enjoy the rest of your day.
Thank you very much. No, it was great to be on. Thank you for having me.
Okay, so that was quite informative, I think, live stream with Greg Stafford MP, and I hope you did enjoy it. If you did enjoy it, I really appreciate if you just gave us a thumbs up, if it's on YouTube, or a like on LinkedIn, I think, or a comment just to say, I thought that was great, or I was interested in this comment, or whatever you want to respond, get a conversation going on even after we come off this live stream. That's it from us for today, but we do tend to do live streams quite often, and we are going to do a regular social care sort of like inform session over the next few months. So please do engage with us. The best thing you can do is subscribe, of course, and if you go onto our website, co-producecare.com, you'll be able to sign up to our newsletter. We are also considering doing a online conference on trauma-informed care and how to operationalize trauma-informed practice within adult social care. And I've been doing quite a bit of background work recently, talking to experts and practitioners in not only in social care. I actually spoke to someone in the prison service on how they're using trauma-informed care, and I'm trying to put that together for the autumn. So we do have a questionnaire. I don't know if we can pop that in the chat. The people in the, in the studio, sorry for that random ask, but we do have a questionnaire just to find out if that would be of interest to people, if you would find who you want me to approach to be at that online conference, and the format. So would it be good to have breakout rooms, or you just want to be able to tune in? It'll be streamed like this, and you can watch it back as often as you need to. We really just want to get a discussion around trauma-informed care, because I'm just coming round to it. I know it's been going on for quite a while, but I genuinely do think that it could have some formative ideas for the way that care is delivered. And so please do engage with the work we do on that. But if anything, if you subscribe to the YouTube channel, you'll find out when we go live with that anyway. So I'm going to end on that point, and hopefully everyone will have a lovely rest of your day. Okay, take care, everybody.